Have you ever been told that hormone therapy is dangerous? That it could cause cancer, strokes, or even dementia? For decades, millions of women were warned. Don't touch estrogen, doctors stopped prescribing it. Pharmacists gave cautionary looks. And women, already struggling with hot flashes, night sweats, and mood swings, felt scared and alone. But today, that's changing. The FDA just made a historic decision. It's removing the black box warnings from all hormone therapy products. For many women, this could change everything. So what really happened? Why did the FDA reverse course after 20 years of fear? And most importantly, is hormone therapy finally safe again? Let's break it down. For years, hormone therapy, or HRT, was one of the most controversial topics in women's health. It's used to ease the symptoms of menopause and perimenopause, things like night sweats, brain fog, low energy, and mood changes. But in 2002, everything changed. That's when a massive government study, the Women's Health Initiative, claimed that hormone therapy increased the risk of cancer, heart attacks, and strokes. Almost overnight, doctors stopped prescribing it. Pharmaceutical companies added bold black warning boxes to estrogen products, the kind you'd normally see on dangerous drugs. And for 2 decades, women paid the price. Millions who could have benefited from hormone therapy were told it was too risky. Even the FDA commissioner himself, Dr. Marty Makary, said during his press conference, 50 million women have been denied or never offered the life-changing, even life-saving benefits of hormone replacement therapy, including my own mother. But now, after reviewing new evidence, the FDA says it's time to correct that mistake. So why the sudden change of heart? According to the FDA, they reviewed decades of new studies. The evidence showed that when used correctly, especially early in menopause, hormone therapy may actually reduce the risk of heart disease, Alzheimer's, and even fractures. That's a far cry from the warnings that scared an entire generation. Dr. Makary said it bluntly, "We are going to stop the fear machine steering women away from this life-changing treatment." Instead of frightening black boxes, the FDA now wants more nuanced information in package inserts, so women can make informed choices with their doctors. But not everyone agrees. The American College of Obstetrics and Gynecology, or ACOG, supports the idea, but with caution. They said the new labels will make hormone therapy more accessible and help women and doctors have open conversations. Yet they also warned, like all medications, systemic estrogen is not without risk. It should always be an individualized decision. Critics say the FDA moved too fast, skipping the usual advisory committee process, which includes more independent experts and public feedback. Instead, they held a shorter expert panel, which some say lacked rigor and transparency. ACOG even wrote, "A 2-hour expert panel is not an adequate substitute for a full advisory meeting." So the question remains, is this a breakthrough for women's health or a risky shortcut? Here's what we know now. The early 2000s study that triggered the fear, it had major flaws. Many of the women in that trial were over 60, long past the typical age to start hormone therapy. Modern research now shows that starting hormone therapy closer to menopause, usually in your 40s or early 50s, can actually protect the heart and the brain. A large analysis of 30 studies covering data from 1966 to 2003 found that early treatment could save lives. And more recent studies, including one published in the journal Cancer, even found that women using HRT had lower rates of coronary heart disease. That's why experts like Dr. Makary believe removing the black box warnings is overdue. The goal isn't to say HRT is safe for everyone, but rather, let's look at the full picture. Instead of scaring women, The new labeling will empower them. It allows women and clinicians to weigh their unique risks and decide what's right for them. As Dr. Stephen Fleischman of ACIOG said, the updated labels will allow shared decision-making without unnecessary barriers. For too long, women have been caught between fear and confusion, told their suffering was normal or just part of aging. But menopause is not a disease. It's a natural stage of life, one that deserves understanding, compassion, and honest information. This FDA decision marks a turning point. It's not about promoting drugs. It's about giving women options, not warnings. Still, hormone therapy isn't for everyone. The best approach is a conversation with a trusted doctor who understands your body, your history, and your goals. As Dr. Macari said, for too long, we've told women menopause is mild and temporary, but for many, it's severe, even life-changing. Maybe now, with better science and less fear, women can finally get the help they deserve. Because the truth is, you deserve to feel good again, to think clearly, to sleep peacefully, to feel like yourself. And if hormone therapy can help you do that, it's time we stop being afraid of it.